I think a lot of attention is paid, at least in the lay press and throughout the industry, on the importance of keeping patients safe. Obviously, it's important to keep patients safe, but I'm not sure as much attention is paid across the board to the importance, the critical importance of the well-being of the people who are delivering the care. So to that end, I would love to hear from some of you on the strategies that you've implemented in your organization to drive a culture of safety from both perspectives, from both the keeping the patient safe, but also focusing on the well-being of the professionals who are tasked with delivering the care. So with that, maybe we could start with Matt.
I mean, what I'll speak to, I think, more sort of broadly is, so I do a lot of work with an organization called the Leapfrog Group, which is a national organization that measures the quality and safety of hospitals and now ambulatory surgery centers as well. And I've actually been working with them for 17 years to help support their measurement and public reporting activities. With that lens, what's been really interesting is I've gotten to hear and see what happens in a lot of healthcare facilities across the United States. In terms of worker safety, healthcare worker safety, I think there's been a big focus on sort of an overall sense of like well-being, right? So obviously there's issues with, things happening with like patients, exerting physical violence on healthcare workers, and I think that continues to be a concern too. But I think there's sort of the emotional side of, for healthcare workers, they're just feeling really burnt out these days. And so how do we look for strategies that help improve that, right? And so one of the things we're looking at the Armstrong Institute is how do we actually look towards de-implementation? So much of our quality improvement work has been asking healthcare workers to do one more thing. Can you do one more checklist? Can you do one more something? And in a time where people are feeling really like maxed out, I don't think we can keep asking people to do more things. So really, how do we think about quality improvement in a new way and with a new lens here in the sort of the near term and the future?